everyone, and welcome to Nursing You. I am Lisa Blake, and I'm here with you to uplift and support nurses. And as I said in a previous video, for the next few videos, we're gonna really be dealing with building your brand as a nurse. And one of the things that I want to mention in terms of building your brand is this: your brain, not this brain. I'm talking about this brain. So let's talk about this brain for a little bit. Oh gosh, here we go. So this brain is how I did my sheet, and everybody has a different idea. And what I've said to you all in the past is that whatever you're doing, build a routine around it. So however you make your brain, unless you see some really crucial and critical ways of improving your brain, stick with it. The only thing I will say about brains is that you have to, absolutely have to, make sure that you keep up with your brain during the night. I don't know about you, but my brain has been in the bed with the patient, on the floor, over by the med pyxis, and at the end of the shift, who knows where it is. So what I encourage you to do is keep up with your brain, and then make sure at the end of the night, if you don't, I won't say much about that, but if you want to keep it as a personal record or something like that, make sure that it is secure and on site. Most places don't allow you to take sensitive patient information home with you. What I would encourage you to do is get in the habit of putting it in the shred box at the end of the night, unless there's something that you think is vital, or maybe at the end of your string of shifts. So for example, if you work 312s, hold on to your brain maybe until that next cycle, and then in case there's a question that comes up after your shift, and then make sure that you're documenting, of course, so you'll have little need to actually keep your brain. But I want to review a couple of points about this brain. So as you can see here, I have the patient's name, their room number. I used to put symbols just because there are certain labs, for example, that are specific to gender. So I don't know whether that's done anymore, because it's been a while since I've been at the bedside, but this is how I would just take a regular piece of printer paper, print paper, and just fold it, because I typically had anywhere from 6 to 8 patients in a shift, and then I would section it off. And if I needed to expand that, I would put it on the back, or I would staple another piece of paper, like if I got admissions and discharges, things like that. But this is how, and we'll kind of bring it down a little bit to show, this is how I typically set mine up. So as you can see here, I have the diagnosis, if I can get my directions together. I have the diagnosis here, the patient's code status, because that's something I wanted. So everything along the borders are information that I can access quickly. So if you can see, I have a couple things highlighted here. I have in Dwayne Johnson's section, I have that he's a DNR. I have that he's a DNR, and also that he's got at 9 in the morning. This is kind of going on the assumption that it's a day shift. At 9 a.m., he's got an IV piggyback. But why do I have that there like that, highlighted? Why is that important? Because it's still pretty early in the morning, because if you start your shift at 7 or 7:30, that 9 o'clock hour hits way before you're ready, way before you know it. So, and I put my information pretty much, I did vary it a little bit, like over here you can see Murphy Brown. I've got her code status up here, and then her diagnosis right there, but generally I keep everything in the same spot, okay? So the IV piggyback I have highlighted because I want to make sure that A, I have the secondary setup already, and that B, my lines aren't expired. And also that's a trigger for me that I need to make sure that that peripheral IV is good. So those are some things there. Also, I have sort of, I don't know if it comes across on here or not, but I have this kind of boxed in red because this patient has an aspirin allergy. So, and Murphy Brown has a penicillin, I believe it's Murphy. Oh, I didn't highlight it there, but Murphy Brown has a penicillin allergy. So then I have my med passes throughout the night, the medications that I'm going to be given. And sometimes it looks like there's so many times written close together, it just looks like one long thing, but that's one thing. I want to add, and then I want to ask you if you notice anything going on sort of here and here. Can you see that? You have two patients with the same last name, which really shouldn't happen. I shouldn't have two patients with the same last name in my assignment. That's really setting us up for a safety issue. But I have it highlighted in red so that Charlie Brown and Murphy Brown, that I can, it's one of those things that kind of grab my attention to make sure that that is addressed when I'm looking at meds and treatments and things like that. So the other thing is, in one of my other videos, I talked about the fishbone diagram. So I want to call attention to Jake Ryan here. So do you notice anything about what's his glucose level? So at a glance, I know not only his glucose level is 500, I mean, this guy is in DKA, right? He's in severe DKA. But also his pH is 7 and his bicarb is 10. It's really low. So again, that puts together the clinical, as I was saying before about the fishbone diagrams, it kind of puts the clinical context in terms of the lab data points in one spot so you can look at it. Also, do you notice anything about Samantha Baker? Samantha has a hemoglobin and it has come up, so I'm thinking that maybe she got some blood. It has come up, but what I want to assess with her is she symptomatic? Is she having any shortness of breath? Is her blood pressure low? Is her pulse high? Things like that. Then I want you to pay attention to what I've written about Boomer Hang. That's right, folks. Super corny. That's right, I own it. He has surgery in the morning. So I've highlighted, I've kind of made a note to myself here that he's NPO after midnight, and they want to start expanding his fluids probably for the surgery. So that's something I want to pay attention at. This is like based off of a midnight shift, whereas this was like a day shift person. This is a midnight shift person. So things that should be grabbing my attention. He's got, what were his PM labs when they come through, so that I know if there's anything off for that surgery that's going to happen in the morning. So that's my brain, folks, and I hope that was helpful for you. And if you want me to expand on any topic, or if there's something that you want to talk about in future videos, please let me know, and I'll be happy to research and get the content ready for you. Thanks, and have a great day.